13.4 Respiratory Disorders. We'll first look at some upper respiratory tract infections. The upper respiratory tract filters many pathogens, many inhaled or swallowed pathogens. Of course, first come in contact with those mucous membranes in the upper respiratory tract, and so it is common to get infections, sometimes viral infections such as the common cold. We can also get bacterial infections in the sinuses, which is called sinusitis. Otitis media is an infection in the ear. Tonsillitis, we mentioned the tonsils in our lesson on the immune system, and occasionally we can get active infections in the tonsils. And also we can get laryngitis. Many times if we have upper respiratory infection, those will continue to move down the respiratory tract, and so we can get various lower respiratory tract infections. Acute bronchitis is an inflammation of the primary or the secondary bronchi. Many times this is a bacterial infection that follows a viral infection. But there is a resulting inflammation, accumulation of mucus and pus, causes coughing and difficulty in breathing. Chronic bronchitis is a long-term inflammation. It is usually due to long-term exposure to pollutants or to cigarette smoke. So chronic bronchitis usually involves some type of degenerative changes in the bronchi, and so you have this long-term inflammation, accumulation of pus, mucus, and coughing. Asthma is a constriction of the airways due to some irritant. That irritant can be dust, it could be pollen, it could be cigarette smoke. In some individuals, even inhaling cold air is sufficient irritation to cause spasms in the smooth muscle lining the airways, and this constriction makes it very difficult for individuals to breathe. Pneumonia is an active infection. This could be viral or a bacterial infection all the way down in the alveoli. So those alveoli are going to fill with fluid, with pus, with mucus, and that is going to make gas exchange across the respiratory membrane very, very difficult. Normally, pneumonia does require some type of antibiotic therapy to eliminate the pathogen. Pulmonary tuberculosis is caused by a specific bacterium. Mycobacterium tuberculosis is the name of the organism. When an individual becomes infected, the body tries to build a wall around the bacteria. It encapsulates it, and this is called a tubercle. The bacteria, if it is contained in that tubercle, may eventually die, or if the individual's immune system becomes weakened or compromised, that bacteria can break out and become an active infection once again. Emphysema is normally caused by long-term environmental pollutants or smoking, and what occurs in emphysema is the walls of the alveoli become distended or even ruptured, and so as a result the surface area of that respiratory membrane is significantly reduced, so there's not as much respiratory membrane. These individuals have difficulty getting enough oxygen into their blood, and as a result the circulatory system, the heart, has to work much, much harder to pump blood to deliver enough oxygen to the peripheral tissues and to the brain. Pulmonary fibrosis is normally caused due to exposure to sand or dust or asbestos. These are inhaled and they are irritants, so the inside of the lungs produces scar tissue, and the scar tissue will significantly reduce the elasticity of the lungs. So the lungs simply will not expand, and these individuals have a difficult time moving air. So remember, we discussed those pulmonary volumes and that inspiratory reserve, that very deep breath. These individuals are going to have a significantly reduced inspiratory reserve because of the lost elasticity inside the lungs.